Hi everyone, my name is Virji-Babul and I'm a professor in the Department of Physical Therapy and director of the Perception Action Lab. My lab is really interested in understanding concussion. Concussion is a brain injury, and it's a very common injury that kids and youth have when they're playing sports. The problem is that we still really don't understand what's happening in the brain. We know that kids experience many different kinds of symptoms, ranging from brain fog to headaches to having trouble sleeping. But what we really need to understand is what's happening in the brain and how does that correlate with the symptoms. My student Sahar is a PhD student who is supervised by myself and Dr. Lindia Wu in engineering, and she has some very new and exciting findings.
We measure brain activity using EEG sensors. Think of the brain as an orchestra with all the different sections, including brass, string, and percussion. And all of these different sections take turns to lead the orchestra and work together to create a balanced, flexible music. Same thing happens in the brain. Different regions of the brain come together and communicate and coordinate to form your thoughts, your awareness, attention, and movement. After concussion, the orchestra is still playing the music, but some of the pieces and sections are off. What we found is that after concussion, regions and networks that are in charge of your focus and paying attention to important information is the most effective. And that might explain why some people experience trouble focusing or experience brain fog after concussion.
We know that concussion doesn't stop the music, it's just changing how the music is organized. And this is really important information for clinicians. We are now working on trying to bring this kind of technology into the clinic, some portable wireless systems that are easy to put on patients as they come in, so that clinicians can actually have information about what's happening in the brain and then relate that to the behavior like brain fog, the movement disorders. The next step of this will be to look at interventions that are brain-based for concussion. For many years, people thought that just after a concussion, you should rest in a dark room. We now know that that completely is the wrong advice. That actually prolongs the symptoms of concussion. What has been found to be really effective is exercise. Exercise actually helps to speed recovery, but it has to be done in a very graduated way. So hopefully with this new work that's coming out, we will be able to bring that into the clinic and really work with clinicians to find evidence-based interventions that will help the recovery from concussion.